Hi everybody, welcome. My name is Abby, Lead Director of Marketing and Business Development here at Bay Area Regional Medical Center, and I've got a new doctor with me today. This is Dr. Candice Dunn. She is an internal medicine doctor at Texas Gulf Coast, right next door to the hospital. She just joined Texas Gulf Coast. How many months have you been there now?
I don't know. It was before Harvey.
Oh, there you go.
Right, I just say like since Harvey.
Since Harvey, there you go. Well, we're glad that you're here, and today we are going to be talking about cold and flu symptoms, the difference between the two. So if you guys are watching and just tuning in, put your comments and questions below. We will absolutely try to answer your questions along the way. And if you need to schedule an appointment, we'll talk about that in a little bit. Dr. Dunn would love to take care of you. So you ready to just hop into cold and flu?
Let's hop in.
Okay, so how do you know if you have a cold or the flu?
I think everyone knows if they have a cold. They have sinus congestion, watery eyes, runny eyes, sore throat. You can have a low-grade fever, meaning 100.4 to 101. Usually it's not much higher than that with a cold. But most people don't get a fever with a cold. You also don't get the body aches and just like feeling awful like you're going to die.
So if you feel like you're going to die, you have the flu.
Yeah, that's
more
the
flu. But a cold,
flu.
you might have a runny nose.
Runny nose, sore throat, some ear pain, nothing awful, nothing that's going to stop you from doing your everyday life for the most part.
Okay, so what's the incubation period of the flu?
Oh, 1 to 4 days. So if you've been around somebody with the flu, you can have symptoms as soon as 24 hours later, or it could take up to 4 days to end up with the symptoms of the flu.
Ugh. Okay, so how do you get rid of the flu?
You wait and wait and wait.
The thing that no one wants to hear.
Nobody wants to hear that. No, okay, so I have a lot of feelings about Tamiflu. Tamiflu is the only available antiviral medication that we have that works against the flu right now. We used to have a few others, but the flu viruses have mutated to the point where they don't work. So if you're a high-risk patient, or if you're a kid, you're more inclined to get a prescription for Tamiflu from your physician. That being said, in the normal population like Abby and I, if we got okay, we'll talk about that later.
Oh, yeah.
But if we were to get the flu, we could essentially pick whether or not we wanted Tamiflu. What it's going to do in us is decrease the length of symptoms from about a week to 5 to 6 days, and it can also sometimes decrease the severity of your symptoms.
So isn't there like a time frame that you have to take it
within the first 48 hours, unless you're high risk, and then you should have it at any point during your illness.
Okay, so that was one of my other questions. So let's just talk about high risk and having the flu. Who is at high risk?
High risk.
What does that mean?
High risk people for the flu are people who are at high risk for having complications from the flu, or being hospitalized from the flu, or dying from the flu. So it would be children, young children, especially infants, toddlers, stuff like that. The elderly, anyone with chronic medical conditions that decrease your immune system, like diabetes, heart failure, anyone on any kind of immunosuppressant medications for rheumatoid arthritis, lupus, things of that nature, anyone who for whatever reason is on steroids, oral steroids all the time.
Okay, we just got a question. I see that. What if you are a cancer patient trying to avoid the flu?
Don't go around anyone. No, you can't do that. So if you're avoiding the flu, if you want to avoid the flu, get your flu vaccine. If you haven't had it yet, the flu is still rampant. I'm still giving out flu vaccines all day, every day to everyone to prevent the flu in those people. Definitely discuss with your oncologist what they think the best timing would be to get your flu shot. But in order to prevent the flu, is avoid going places where people are sick, like doctor's offices. No, it's never too late to get the flu vaccine. Okay, so the question that we got asked was if you're the cancer patient, but then she said she got the worst flu ever after getting the flu shot last year, so she stayed away. That was just bad luck. Sorry. The flu shot does not cause the flu. Is it too late to get the flu vaccine for kids? Absolutely not. I'm the worst mom ever, and my 18-month-old got the flu in November, and we just got her flu shot at her last appointment last week or the week before, so definitely not too late.
So while we're talking about kids, what can I do to protect my children who are too young to get the vaccine? And what do you know the age?
6 months. Nobody's too young. Get your kids their flu shots. So every kid over the age of 6 months old should be getting their flu vaccine. Talk to your pediatrician about it for sure. But if they're less than 6 months of age, you should be getting your flu vaccine in order to decrease the transmission.
Are you reading that question right there?
Yeah, sorry.
Okay.
So if you have a little kid at home, if you have a baby 6 months old or less, then you need to get your flu shot so that you don't give them the flu. Keep them away from anyone that has even sneezed. If they are in daycare, there's not a lot you can do about that.
That was my question. If they're in daycare and all of the kids in daycare are getting
they're
the
all
flu.
sick. Yeah, there's not much you can do about that. But the baby rooms at most daycares are kind of secluded from the toddler rooms. They don't go in, but siblings and whatnot.
Yay, love siblings. Yeah. Okay, so how can I protect myself from the flu? We kind of talked about the flu shot.
Let me answer this question real quick. What can I give my son? He has a blister virus. Anything that I can help him with the pain? I'm not sure what that is or what you mean, but if he has anything in his mouth, I'm assuming Maalox over the counter. I don't know how old he is. This isn't the best medical advice, but Maalox in a syringe, and you can put it in his mouth if that's where the blisters are.
Awesome. Okay, so you guys, if you're just tuning in, we are live here with Dr. Candice Dunn. She's an internal medicine doctor at Texas Gulf Coast. She is located right next to the hospital in the 250 Blossom building. And she just started with Texas Gulf Coast. We're so excited to have her here talking about cold and flu because my son had it, I had it.
My daughter had it.
It's just crazy, and it just lasts forever, and you just feel horrible, and there's just a lot of things that people need to know. So I have some questions that Macaroni Kid, League City Clear Lake, she had some questions that she would like for you to answer as well. And if you guys have any questions along the way, if you're watching live, y'all post them down below, and we'll do our best to answer those along the way. Okay, so what is the difference between flu A and B?
They're just two different strains.
Okay, so
it's a very long, complicated, drawn-out thing, but it's just two different strains. They have different proteins on their capsules.
So is one worse than the other?
No.
They're just different?
They're different.
Okay, so can you get A one week and then B the next?
You can get
really
A
hoping that
this week, you can get B the next, you can get A again the next week, you can get the flu 10 times if you're that unlucky. I hope you're not, though.
Oh, joy. Okay, so use lots of
hand sanitizer, masks. If you are sick, coughing, wear a mask, please.
Yes, and stay home. And don't share that with people.
And if you do have a cold, the flu, whatever you've been diagnosed with, or if you haven't seen a physician, wait to go back to work until it's been 24 hours since you've had a fever.
Okay, so can you preemptively take Tamiflu if a family member has the flu?
Yes. So in individuals who come in and one person gets tested positive, we do offer Tamiflu. It's a different dose and a different amount, but we do offer the whole family Tamiflu. That way the whole house isn't knocked out and not going to school and work. So
that
especially
helps.
with kiddos, or a lot of people have elderly living with them, or like our previous question was with cancer patients. You know, there's always somebody in the house who is sick and needs the Tamiflu. So
you can do that.
Yeah.
Awesome. Okay, so is the flu shot really effective?
Is it? Okay, so this is going to answer a question previously, and this is essentially why I'm doing this today, is because I've heard a lot of things. I know a lot of things have been reported on the news, and your physicians and maybe even urgent care has even told you that the flu shot is not effective. Okay, let's fix this. The flu shot is effective against the flu B virus. I've actually only had 2 B positive patients, and they have not had their flu shot this year. So that being said, the flu vaccine has been the cdc.gov. If you want to check out all the data, it has data for the past 50 years about the flu vaccine, including this year's. So the strain that we're seeing the most is flu A, and it is an epidemic. It's all over the nation. It's really bad in Texas. It is 39% effective in preventing that strain. Now, you may say to yourself, well, it's only 39%. But if you get the flu and you have had your flu shot and you have flu A, number one, it's like a cold. It's not nearly as bad. The symptoms last for about 4 days versus not having your vaccine. They last about 8 days. I can literally walk into a room of a flu positive patient and tell you whether or not they've had the vaccine or not. also with that 39% effectiveness, not only are you protecting yourself, you're protecting everybody around you, like those kids that we've been talking about, and the elderly, and people with cancer, and people with in immunocompromised systems. So it's not only for you, it's for everyone else, and the kids in your daycare, and the kids in your kids' school.
So if there's a person that has a higher risk of getting the flu and have other complications, what kind of complications would they have?
So the most common complication from the flu would be a post-viral or flu-associated pneumonia, especially anyone who smokes, has lung problems, has COPD, things of that nature. So the most common thing I've actually seen this season are people who are immunocompromised, meaning they're on some kind of medication that decreases their immune system, or they have some kind of illness that decreases their immune system, and they end up with a bacterial pneumonia on top of the influenza.
So are those people going to be hospitalized with pneumonia?
A lot of them are. I'm sure everyone's been watching the news. We've had 30 pediatric deaths from the flu, and I can't even tell you how full all the ICUs are just around the state and around the city, with people being hospitalized with the flu.
Wow. Okay,
Yeah.
so if you guys are tuning in, we are here with Dr. Dunn talking about cold and flu. So if you have any questions, y'all comment below, and we'll try to answer those as much as we can. So let's talk, let's talk about you for a minute. Why did you want to become a doctor? And then we'll answer that Tamiflu question, okay?
Why did I want to become a doctor? So I actually never wanted to do anything else. So since I was 4 years old, told my mom I was going to be a doctor, and she was just like, what are you talking about?
That's awesome.
I like people, 30 PD deaths in the nation. I like people. I like science. I'm a huge nerd. And it's my favorite science. You get to figure out what's wrong with people. You get to help them. I'm good at it.
That's awesome. Okay, so let's go back and look at this question right here.
This is for Nicole. Hey, Nicole. It's good for all the strains. It's not strain specific. So the medication I had referenced earlier that we don't use anymore was strain specific, and then that strain ended up mutating, and it doesn't work anymore.
There you
so
go.
We use Tamiflu for any positive flu.
Awesome. Okay, so tell us a little bit about your background and education.
So I was born and raised here. I was born in Houston, raised in League City. I did my undergrad up in Dallas at UT Dallas. I did medical school at Texas Tech. So I've lived all over the state. I have to say Houston is better than Dallas, but I really do like West Texas. West Texas is a neat place. And then I did my residency training down in Galveston, and here I'm back home.
So why did you choose to go to Texas Gulf Coast and be affiliated with Bay Area Regional?
I definitely wanted to come back home, so it was a big thing. So my favorite thing about not only Texas Gulf Coast, but the hospital as well, they're so into the community and allow us to do things like this. Like in the middle of a work day, I get to come over here and answer questions for people who are either at work or busy, or can't just text a doctor and get their questions answered that easily. It's just a big thing to be a part of the community, and they're great about that here.
Awesome. Okay, so if people want to make an appointment with you, how do they reach you?
So you guys can call 281-604-1300 and make an appointment with me. I have open appointments every day.
Okay, you guys can also go online and book an appointment through the website. You can go to txgulfcoastmed.com and use the online appointment scheduler there through ZocDoc if you would like to do that while you're online. All right, I see some other questions here.
Okay, so I don't know if you actually tested flu positive this year, but there was another virus going around that had awful headache. The question says, I suffered for 1 whole month last year with flu, high fever, runny nose, bad taste. Then this year it's headache, stuffy nose with wheezing and congestion. So your symptoms when you get the flu are actually your body reacting to the virus. So everyone's symptoms can be different when they get it, unfortunately. There's no set symptoms. And if it lasted for a month, if anyone feels bad for more than 5 or 6 days and you're kind of waiting to go in, just go in. We're not going to be upset about it.
Okay, Dr. Candice Dunn is located at the 250 Blossom Street, right next to Bay Area Regional Medical Center. And the number is 281-604-1300. All right. Any parting words before we go?
Get your flu vaccine, please.
Wash your hands too.
Wash
Yes?
your hands. Antibiotics don't help with the cold or the flu.
There you go.
Yeah.
Awesome. Y'all have...
pregnant ladies, get your flu vaccines.
Yes.
All you preggers out there. Okay? Okay.
All right. Y'all have a good day. Talk to you soon. Bye.